At this time, I would like to welcome Kelia Armas-Velasquez. Kelia will be speaking in Spanish, so I want to remind folks who are not bilingual in English and Spanish to go to the bottom of your screen and select if you choose to hear in English, you can go and choose interpretation and then English so that you can hear interpretation when she's speaking in Spanish. You can hear the English interpretation when she's speaking in Spanish. So I will introduce Kelia. Kelia also works at the North Carolina Department of Health and Human Services, but in the Division of Child and Family Well-Being, where she is a parent consultant with the Early Hearing Detection and Intervention Program. As an immigrant parent of a deaf child herself, Kelia shares her personal and professional expertise when supporting families who have children with hearing loss. Kelia will share a little bit about herself with us and the work she does. Welcome, Kelia. Bienvenida, Kelia.
Esta es Kelia. Muy buenos
Hi,
días.
this is Kelia. Very good morning to everyone. If I could have my video enabled so I could have my camera on.
Does that work for you, Kelia?
Funciona ahora para...
Excellent. Thank you.
Bueno, muchas gracias. Muchas gracias por esa
Thank you.
presentación.
Thank you for that introduction, Susan. So I'm Guatemala nationality. My family and myself, we live in Wake County, and we have 3 children who are 14, 6, and 3 years old. David, my oldest son, was born in Chapel Hill, and he did not pass the auditive test for recent born kids. So he was referred to the audiology clinic to do further tests. When he was 3 months old, I received a diagnostic that my son had auditory loss, which was neurosensory, bilateral, which was very profound. And when he was 1 year old, he received his first implant on his left ear, and 1 year later, he received his second. So thanks to God and professionals who supported me, David was able to hear very well with his implants, and he was able to learn to speak English and Spanish. And now the whole family is in process of learning ASL. And David is in 8th grade. He's finishing 8th grade with very good grades. So I'm very proud of him. When I started this journey of auditory loss, I didn't speak any English, and the resources in Spanish were very scarce. And everything was completely new because I didn't have anybody in my family with auditory loss, and I wasn't familiar with the medical terminology. Even though I had an interpreter at my appointments, I was always left these appointments very confused and not very clear about what the next step was. And I was also very worried because I didn't know if he would learn to speak Spanish, because all my family lives in Guatemala and they only speak in Spanish. So there was the time in which I kind of froze up and I didn't do anything because I didn't know what I was supposed to be doing. And I was afraid to make a decision to which I would regret later on. And so when the moment arrived to get the implants for my child, my cultural beliefs were a barrier, because in our culture, there's a lot of myths that go against advanced technology, and it's very difficult to overcome those. But that issues for a different presentation. And so I wish to meet somebody who spoke my language, who helped me to understand my process, and who had experience with a similar situation to my own. So when David was 3 years old, I started to start a support group in Spanish in Facebook for families with deaf children or who had auditory difficulties. And I started to share my experience with families who are starting in their journey of auditory loss. And I helped them to understand the process. In 2022, the program of early detection of auditory loss, NCAD for its English initials, hired me part time as a consultant with parents to support parents in a more personalized way. So this program supervises evaluation, auditory evaluation to uh, recent born babies and follows up with those children and babies who have auditory loss. So the objective of HEDI is to reduce or eliminate the possible impacts of auditory loss through detection and early detection and evaluation, evaluating all babies to detect auditory loss before 1 month old, diagnosed babies who were not able to pass a test before 3 months old, and to register them in programs of early intervention before 6 months they are 6 months old. Thanks to this program, my son David was able to receive intervention at a very early age, and that allowed him to be successful. And so now we have 5 support groups in North Carolina in Spanish. And so if you need more information, please let me know, and I'd be happy to share all of that, the links for those groups with you. Thank you very much.
Thank you so much, Kayla. I really appreciate it. Muchas gracias, Kayla. I really, really appreciate our interpreters who have joined us today, the wonderful sign language interpreters from DHHS, David and Diane, and Kayla, our wonderful presenters, our great staff, our wonderful Spanish interpreters from Tilde, and everyone here today.